One of the most common procedures I perform in my office that I absolutely love doing is porcelain veneers. The reason I love porcelain veneers is because they're great for chipped teeth, cracked teeth. They're great if somebody had like a trauma and they broke their tooth and you can fix it. They're great for changing the shape and the size and the color of the teeth. And why I like it as opposed to other procedures is that it really does make a huge difference in the patient's overall appearance. It can make somebody look so much younger. It can bring youth and vitality to the face, or it could just lead them to have what a patient may feel is a better smile and help them feel more confident and help them smile again. A lot of the patients I treat, they tell me that they've trained their lips to not show their teeth when they smile. They don't smile in photos. They want to smile in photos with their kids at their birthday parties and stuff, and they don't do that because they don't like the way their teeth look. They don't like the way their smile looks. So being able to give back to my patients and changing their smile in this way is so rewarding to me. So let's talk a little bit about porcelain veneers. Porcelain veneers are like a thin layer of porcelain that we can put over the teeth, and we can literally create a brand new look. And there's so many different ways to use them. You could have one, you could have two, you could have four, you could have the whole top arch, you could have every tooth in the mouth. Really, it's whatever the patient wants and sometimes what the patient needs. I usually recommend it to patients when they say like, I want a whole new smile. What I'll recommend is for them to really look in the mirror and see what they're seeing, and maybe consider doing how many teeth you see when you smile. Like for me, you see 10 teeth. If I was gonna do it, I would want a really uniform appearance. So for myself, I would recommend 10 teeth. I have patients that do one or two, and they're perfectly happy. They love just doing a few teeth here and there, and sometimes that's all you need. You just need a few teeth to make it look right. So let's talk about the procedure in a little bit of detail. The first appointment, let's say we've already done the exam, we make sure everything's healthy, that you can go ahead and actually have the veneers done. The first thing we'll do is take some photos and we'll take some models, and we mount the models on what's called an articulator so that we can see how your teeth function. And then we create a wax up of what the teeth will actually look like. So that wax up is a blueprint of what the teeth will look like when we're finished with the procedure. What this does is it really gets the patient and me on the same page so that I understand what the patient is really looking for aesthetically, and the patient understands the limitations of their smile and what we can provide for them. Some patients want to make their teeth a lot longer, but they're not able to because of the way that they function, the way their teeth work when they're moving, when they're eating, when they're talking. We don't want to risk them breaking anything, so there are limitations. So the patient understands these are the limitations, and I understand what they're looking for aesthetically. And together we can create a wax mold of the end result. Because once you start the veneer procedure, it is irreversible. We do have to remove a little bit of tooth structure. How much tooth structure depends on the case, depends on what outcome we're going for. But typically it's less than 1 millimeter. Usually it's about half a millimeter to like 0.7 millimeter, but it really depends on the case. So we get on the same page. So the next appointment would be where we prep the teeth. So the patient will come in, we get the patient numb, so there's no pain in this process. And then we will prep the teeth, we'll take the impressions that we need for the lab to manufacture the veneers, and they're all handcrafted beautifully by a ceramist, and it takes about 1 to 2 weeks for turnaround time. And the ceramist will sit down with photos blown up in their laboratory, in their office, and they hand create all the teeth that will fit that individual's face. So it's not like a cookie cutter thing that's being pushed out of a machine. It's really handcrafted for the individual, and the veneers are built from the inside out. So there's like 30 different shades of porcelain that go into it to make it look natural, make it reflect light naturally, the same way a natural tooth does. That's why it's so important to make sure that whoever you're going to has a lot of experience doing this and that they really know what they're doing, because there's a lot that goes into making that smile look totally natural. So after we prep the teeth and take the impressions, we make temporaries that match the wax up, and then the patient will wear those temporaries for about 1 to 2 weeks to make sure that they're happy with the way the shape, the size, and everything looks. So if there's any changes that need to be made, we can make those changes. Then the next appointment, the patient will come in. We take off the temporaries, we try in the permanents, and we make sure that the patient is 100% happy with what they are receiving. They get to see it before we permanently put it in, because once we permanently put it in, it's in there. Like, we'll have to actually start from scratch if the patient wants something changed. So we want to make all the changes before we permanently put them in. Once we get okay from the patient, then we will prep the teeth, we prep the veneers, and then we put them on, and the patient gets to leave with a brand new, beautiful smile. So I know that was a lot of information all at once, so if you have any questions, please leave them in the comments below. I'm happy to answer them for you. I'll talk to you soon.